How common is endometriosis now? The studies and the stats show us that it's probably prevalent in about 10% of the female population, but I would say that that's probably underdiagnosed. It's probably a low number. There's no reason why one woman would have it any more than others, but we'll get a little bit more into why that is. Okay, so Dr. Madhu, if it doesn't affect one race or ethnic background more than others, why are we talking about it in terms of South Asian women?
Good question. It's more prevalent in South Asian women, the whole concept of pelvic pain due to endometriosis, because it's often undiagnosed and untreated. Asian individuals, compared to their white counterparts, are more likely to have their endometriosis-related pain dismissed by healthcare providers and have a higher burden of disease before referral.
Welcome to Avaz. I'm Roop, your moderator. This is Avaz, the podcast for South Asian women's health and wellness issues, and we're here to provide you with information on various health topics. I'm here with our fellow hosts. Hi, I'm Dr. Nab. I'm an emergency room physician with many years of experience working with both South Asian and non-South Asian patients.
And I'm Dr. Madhu. I'm a family doctor, and I've been working for over 25 years, and I largely deal with the South Asian population.
So today we're going to talk about an experience that very many women seem to have, which is pelvic pain. And we're going to talk about the common reason for some of that pelvic pain and tell you why it's often found in South Asians and why it both is underdiagnosed and undertreated.
Well, we're going to talk about specifically endometriosis today. So what is endometriosis? The endometrium is a lining in the uterus. When that lining goes outside of the uterus, that can cause pain. Sometimes it does, sometimes it doesn't. But when it does, it can cause a lot of pain. Now, when the lining of the uterus goes outside of the uterus, where does it go? Most commonly, it goes to the ovaries, about 55% of the time. After that, it can go to the fallopian tubes, the uterine ligaments, and even the bowel, so areas around the pelvic area. And that can cause a lot of pain. So we're going to talk about that specifically today as a cause of pelvic pain.
How common is endometriosis now? So the studies and the stats show us that it's probably prevalent in about 10% of the female population, but I would say that that's probably underdiagnosed. It's probably a low number. And in fact, when women have procedures done to test for other things, like if they're getting tested for infertility or other causes of pelvic pain, but they're not having any symptoms in that area, they might just end up finding 20% of cases of endometriosis in these women who don't have any symptoms of double pain. Yeah, so it's actually much higher than what we think. And in fact, if they're having investigations specifically for pelvic pain, the numbers widely range anywhere from 24 to 82% of causes of pelvic pain are found by laparoscopy to be caused by endometriosis. And endometriosis is primarily found in women of reproductive age. The most common age of onset is age 28, so long after your periods have begun. And there's no real racial or socioeconomic predisposition, so it doesn't affect one race more than others, or doesn't. There's no reason why one woman would have it any more than others. But we'll get a little bit more into why that is. Okay, so Dr. Madhu, if it doesn't affect one race or ethnic background more than others, why are we talking about it in terms of South Asian women?
Good question. It's more prevalent in South Asian women, the whole concept of pelvic pain due to endometriosis, because it's often undiagnosed and untreated. So now why is it undiagnosed and why is it untreated? It's the pain tolerance that South Asian women have. It's the perception that, but I should have very painful periods. Some women do believe that. They feel like if you don't have that pain, then it's really not a good period. There's also the taboo of discussing anything about your period or discussing it with a male physician. You sort of feel sort of ashamed or shy, and so you don't want to talk about it. But another important thing which we have seen in the recent past with the pandemic is that racialized communities do face barriers to healthcare access. And this does include the South Asian community. And in fact, I'm going to look at my notes for this so I don't get this wrong. A study was done here in the province of British Columbia by Amanda Howard and Jessica Sutherland that showed, and I quote, Asian individuals compared to their white counterparts are more likely to have their endometriosis-related pain dismissed by healthcare providers and have a higher burden of disease before referral.
And so we know there is some bias in healthcare system. Maybe it's not direct, but sometimes indirect, right?
Unconscious bias.
Exactly.
So that's probably why we're talking about it. So women are aware and they can do something about it.
And did I interpret this correctly that South Asian women tend to have a higher threshold for pain?
I think it's not like a genetic thing that we have a higher. It's a cultural thing.
Yeah.
It's a pain tolerance or goina, tiko juga.
We'll put up with more.
Yeah. Put yourself on the back burner. Goina. Chal hartuga rotingalani ane.
Yeah.
So you just don't
There's
take
so
care of
much
yourself.
else to do, right? There's so much else to do. You
Exactly.
don't have time for pain.
You don't have time for exactly. Who has time for pain?
Okay, so if you are experiencing endometriosis, how do you know you have it? What are some of the symptoms?
Well, I mean, honestly, it's very painful periods. It's pain during intercourse, and it's even pain with bowel movements or urination. So those are some of the symptoms. Dr. Nav?
So one of the biggest ones, and the reason we're talking about this today, is the issue of chronic pelvic pain. So not just pain around the time of periods, which is when endometriosis usually presents, but pain all the time, constantly. The definition of chronic pelvic pain is that you've had it for at least 6 months. And, obviously in the context of how we're speaking about it today, many women have had it much longer than that. So chronic pelvic pain, which is severe, debilitating, interferes with your daily life. And it doesn't always correlate with the severity of the disease. If you were to look inside their abdomen with the laparoscopy, it might not look that bad. But because of various factors of nerves that go to the pelvic organs and the inflammation, the perception of pain is much higher, and so they actually feel more pain than what the severity of disease would suggest by looking at it. So that's one big element that we'll be talking more about today because we feel it's a very important aspect of dealing with endometriosis. In addition to that, you might have excessive bleeding. So women that suffer from heavy periods, it might be because of endometriosis or bleeding in between periods. And then infertility is another one. So endometriosis can be a fairly common cause of infertility as well.
That is something that's investigated. Then you might have non-specific things like being tired, bloating, abdominal pain, that kind of stuff. And, when you're feeling this way, you have this chronic pain, people tend to become a little anxious and depressed as well. So then as a result of the pain, you get anxious and depressed because you're not feeling well.
So I just want to reiterate something that I heard, that chronic pain is something that occurs on an ongoing basis, and it is at least happening for 6 months or longer. Yeah, in general, yeah. Okay. I think that's important because, if you have your period and you're having cramps, you think, oh my God, is this something more than just menstrual cramps? But if it's not happening all that time, for 6 months onwards consistently, then probably not something you need to worry too much about, right? Okay. And so how do you know that you have endometriosis?
Well, that's a really good question. So again, it could be the symptoms that we talked about, but the amount of pain isn't necessarily related to how much endometriosis you may or may not have in you. So some people have, as Dr. Nav mentioned, no pain at all, and then incidentally someone's doing, let's say, a laparoscopic appendectomy or whatever they're doing, and they go, oh, there's some endometriosis here. And then there's some people with very severe pelvic pain, and they do have endometriosis, but the disease burden, how much they actually see inside, is not a lot. So we need to consider endometriosis if you're having painful periods, and especially if it's a new onset, like before you were totally fine, and all of a sudden you're having painful periods that are continuing on a regular basis.
So let's just say you're going in for another procedure and they find you have endometriosis. Do they need to do anything about it?
Not necessarily. So if you're not having issues with, let's say, infertility, or it's not really affecting your lifestyle, then you don't usually need to do anything about it. You can just keep monitoring it and seeing how the patient's feeling.
So interesting that you could have a little bit of endometriosis and a lot of pain, and vice versa, a lot of endometriosis and maybe very little pain.
Yeah.
And that's the important thing to mention. For sure. And so what causes it? Why does it happen in some women, and why does it bother some women more than it does others? Yeah, it's an interesting question because there seem to be a couple of theories. One is called retrograde menstruation, which essentially means that at the time that you're having your period, some of that blood flows instead of through the fallopian tubes and out through the uterus into the world. It flows the other way around. And so it kind of goes back up through the uterus, through the fallopian tubes. And then because the fallopian tubes are open-ended, they're not actually physically attached to the ovaries. Those blood cells can then go into the pelvic cavity and then can cause endometrial tissue that goes along with it to implant in areas outside of the inside of the endometrial cavity or the uterus. So that's one reason. And another reason is called cellular metaplasia. So when cells can change from one form to another, so cells outside the uterus would change into the type that are usually found inside the uterus. And so they kind of morph into these cells that then start to produce the same type of changes that you would see inside the uterus when you're having your period. Wow, the body is pretty amazing.
It is, right? So much we don't know.
Yeah. And what are some of the complications that a woman might incur if she'd had endometriosis?
Well, I mean, the main is you're having pelvic pain. So it's really affecting the quality of your life. So you're not feeling well. It affects how you can even function at work. There's a lot of sick time days that people miss from work because of their pain. It also affects your quality of life in terms of your sexual health. So you're having painful intercourse. That affects the quality of the sexual health with your partner. So all of those things are important. The main complication that I think truly has another large impact is infertility. So endometriosis is associated with infertility. And so when people are having problems conceiving, that is one thing that impacts them. And having all of these issues happening does play on your mental health. So it can cause you to feel a bit down and depressed. And so that is a real part of the disease process.
So if someone has got some sort of symptoms for it, how can they get tested for endometriosis? Yeah, so that's a key point. You have to be having symptoms for you to undergo diagnostic testing. The most simple tests are to get imaging like an ultrasound or pelvic examination even, like just having your primary care provider do an internal examination to see if there's areas of tenderness when they're examining, followed by then an ultrasound or a pelvic MRI, which are not that easy to get, but they can be ordered. And finally, the gold standard, the way to find out whether you have endometriosis is through laparoscopy. And that is a surgical procedure that is done as a day surgery by a gynecologist. And it's a laparoscopy, meaning that they put in little incisions into the abdomen, put in cameras, inflate the abdominal cavity, and they look in with a camera to physically see if there are areas, patches of endometrial tissue where they shouldn't be. Okay. And in fact, with that laparoscopic procedure, they can also, if they already have a high likelihood of that, they think you might have endometriosis, they can then also go in and fix the problem surgically if it's a high burden of disease at the same time. Okay. But sometimes just getting that pelvic exam at your doctor's office, might that be enough? Or would you always associated with an ultrasound if you're querying, if you're questioning the possibility of endometriosis as a diagnosis? Okay. And then once you've tested for it, and let's just say it's been now diagnosed, what are the treatment options for somebody?
So there is no cure for it. So it's not like we can give you this one treatment and it'll go away, but we can manage it. So there's different ways of managing it depending on where you are in your life. So there's factors like how bad is the disease? How bad are your symptoms? What is your age? Are you planning on having children? So there's lots of different approaches to this. And not all treatments work well for women. And some treatments might work well. And once you have the treatment, it's working and then it can come back. But there's three main sort of arms that we treat it with. One is hormone treatment, pain management, and surgery. So I'm going to talk about a little bit about hormone therapy. The hormone therapy what it does is it sort of causes endometriosis to go through cycles like your periods. And so you can sort of control it that way. And again, depending on your age, depending on whether you want to have kids and so on, there's different types of hormone therapies. So I'm not going to get into the specifics of that because there is not a one size fits all. It really varies on your age and what your sort of your end goal is. And then of course there's
Yeah, there's other non-hormonal therapy. So NSAIDs or non-steroidal anti-inflammatories, like even something like ibuprofen, naproxen, that sort of thing. They're fairly effective in treating pelvic pain in that part of the body. And then if you're not getting any relief from hormone therapy or from non-steroidal anti-inflammatories, then surgery may be an option, but that would be something to discuss with a gynecologist once you're referred to one.
And one thing, sorry, I did miss on the hormones. The purpose of the hormones is to basically slow down the growth and the symptoms that are related to endometriosis. And they can come as a pill, an injection, a patch. So it just really varies.
What's like you said, it usually occurs around average age of 28. Does it end once a woman hits menopause or perimenopause?
That's a good question. Because endometriosis is mimicking your period. So once you do have menopause, then yes, because one of the treatments, the hormonal treatments, is basically inducing menopause. So yes, so once your hormones are shutting down and the endometrium is not responding and you're not having a bleed and having a menstrual cycle, then yes, you don't have those symptoms anymore that are
So
debilitating.
menopause is actually good for something?
Yeah. Yes, menopause is good for something.
You were mentioning that, endometriosis is often underreported and underdiagnosed. And you also talked earlier to me about the burden of pelvic pain and how women assess pelvic pain and what they might do about it. Can you talk a little bit more about that?
Yeah, so again, we talked in the beginning of this episode about how women might delay seeking medical attention for painful periods or heavy periods or chronic pain in the pelvic area. So that is definitely one of the burdens of having pelvic pain, is that you don't get the treatment at the right time. And so the endometriosis develops further and then you end up with more pain. So that's one of the aspects that we wanted to discuss today.
I think also just women trivializing their pain and saying it's okay and being able to carry that burden. I think that is also a burden to saying, oh, it's okay, this is normal. And also the burden of pelvic pain in terms of how it affects your mental health and well-being. So pelvic pain is not just about the pain here, but it's about how it affects your day-to-day living, your ability to go to work, your ability to manage the household, and just your quality of life, your enjoyment.
Mm-hmm.
Yeah.
And there's a lot of times that even medical professionals may not have enough knowledge about pelvic pain, especially in, we don't want to single out males because women can be similar. And so that's why we find many women get frustrated, depressed, sad, angry, because they feel like their concerns aren't being validated and they're not really being listened to when they present with pelvic pain. And then again, the same thing happens. By the time they finally have someone that hears them out, then the disease has progressed to the point where further treatment is necessary.
And also then the delay in getting referred, right? Because you've been sort of waiting for so long. So it is a frustrating process.
Yep.
And it sounds like it can take so long because from the point where you feel pelvic pain and you tell yourself, oh, it's not that bad, this is normal pain and I should just be able to grit and bear it and I'm too busy doing other things, I can't do anything about it. And then you finally go to see your doctor or a healthcare professional and they're like, oh, it's just part of this, it's part of that, maybe it's not that big of a deal. And then if you're South Asian, you're going to be heard even less. And then so now it's progressed and now it's really painful. And now your treatment options are also going to be changed. So it can actually be something that has been, I guess, been a detriment in your life, a bigger problem in your life than you actually even know by the time you get it resolved.
Yeah. Mm-hmm.
Wow. Okay. So any final thoughts on endometriosis?
I think endometriosis is one cause of pelvic pain. There's others which we're not going to get into today, but I think that if you are having ongoing pelvic pain, especially in the childbearing age, then I think that's something that you might want to consider and bring up with your doctor and get further investigations.
And I think that, again, just bringing it back to the South Asian community, I think so many women in the South Asian community, they believe that it's normal to have heavy periods or normal to have painful periods. And we just want to tell our listeners that that's not the case, that if you're suffering from pain as a result of having these heavy incapacitating periods, then you should reach out to a healthcare provider and get some help for it because there is help available for you.
Yeah, we just want to empower you so that you can get the help you need to live the best quality of life.
I think it's really important to have the conversations around periods to see what other women are experiencing or teenage girls when they're having it, just so we know that what might be normal and might be abnormal, because so few of us have grown up having these conversations in our homes. So we do hope that by listening to this particular episode, you will start to have some of those conversations with your daughters, with your mothers, with your friends, and start to understand that some pain can be normal around the time of the period, but other ongoing pain is not. And that's when you should check it out.
But I wanted to, you said something interesting. And so I was prepping for this last night, and you said you should have these conversations with your mothers, your daughters, and your sons, and your husbands,
Correct.
because your partners, whoever that is. Because I was talking, while I was doing this, my son said, "Oh, this should be a normalized conversation in the house." And I said, yes,
So right.
good.
You're so right.
That was a great point.
Yeah, because we live with men in our house,
And they should know how women feel.
and they should be able
Yes,
to
they
support women in their whole search. We hope you've learned a few things today listening to our podcast episode on endometriosis. We are Avaz, a South Asian women's health and wellness podcast. You can find us on Instagram at Avaz_voice. We're also on TikTok, Facebook, and you can watch us on YouTube. So please join us again next time. We are available for you to send us your questions, your requests for topics, and we do hope that you will like, listen, and share. Thanks again. The information in this podcast is not a substitute for professional medical advice, diagnosis, or treatment.